One of the more painful conditions we treat are thoracic and lumbar vertebral body compression fractures. A compression fracture occurs when a bone in the spine collapses and creates pain and deformity. A lot of times patients are unaware that they have these fractures, and they can be very disabling most of the activities of daily living. The way we diagnose these fractures is using MRI or CT and sometimes X-rays. Treatment consists of bracing with a back brace, as well as rest, ice, medications. A lot of times these conservative measures will fail, and we'll need to do more advanced treatments such as kyphoplasty. A kyphoplasty is when we take a needle and we place it within the vertebral body, and we inflate a balloon to restore the height of the vertebral body. And then after we have inflated that balloon, we remove the balloon and then we inject cement into that vertebral body. That cement will then harden over usually about 15 to 30 minutes. Once that cement is hardened, it stops the vertebral body from moving and allows it to heal. Usually, once that treatment is performed, pain relief can be dramatic, and usually within 1 to 2 weeks, patients can return to their full and normal activities of daily living.